Good evening, everybody. For those that don't know, my name is Stuart Schlossman, and I too have MS. And a long time ago, this is when this all began. And, you know, what we try to do is try to provide something that many others are not providing, and that's aspects about multiple sclerosis that are not learned when you attend others' programs. So we do hope that you learn from the programs that we're providing, and we do hope that you share them with others. Fortunately, also, we video record almost every program we do. And for that, you see the cameras in the front of the room. We would appreciate you not walking in front of the camera in case you have to get up. But there were people from all over the country that are watching these, and all around the world, actually. Last year, over 140,000 people clicked in and watched videos from our YouTube channel. We hope that you were able to, see something on there as well. If you have never done it and you want to learn something about multiple sclerosis that you don't know and you do want to know about, that would be the place for you to go to. Today's program, we want to thank Sanofi-Genzyme. Sanofi-Genzyme did give us, or has worked with us all year on putting together and helping us to do these programs. We cannot do these programs without the pharmaceutical industry, and we hope that everybody's able to thank them as well. So I hope that you all can thank them. Yay. All right, our first speaker, Constance Easterling, is an MSN ARNP clinical coordinator, nurse practitioner at the MS Care Center of Neurological Services, Orlando. She's worked in multiple sclerosis since 1998. Received the June Halper Award for Excellence of MS Care in 2009 in nursing. By the way, she wrote this thing in like 4 font, so it's hard to read, excuse me. Connie has written and contributed to numerous books and articles on multiple sclerosis care of patients and families. She's past president of the International Organization of MS Nurses, and with Patty Bobryk, PT, she wrote proposal for first MS Center in Orlando area in 1998, and that's why you have that MS Center here, so let's thank her again. Right, Connie? There you go. Connie's going to come on up here, and she's going to wow and dazzle you, okay? Following Connie, we're going to have Patty. After Patty, we're going to have Tricia. Then we're going to do a Q&A, and then you all get to run home.
So I knew that sex program was just too much for you.
Yes.
Okay.
She did one a few months ago.
I did. I guess it was just too over the top. How many of you that are here tonight were at that program? Bunch of you. Was it over the top? No? Okay. Well, he dumped me for a sexologist. Okay. So let me move this down a little bit. I hope y'all can hear me. I'm actually not well tonight, so I appreciate Stuart letting me leave after I speak. But I've had I don't think it's the flu, but I've had bronchitis, and the doctor told me it's probably pneumonia now, although I refused the chest x-ray. So of course, yes, nurse practice and all that. But what I'd like to do tonight, Stuart asked me to talk to you about comprehensive care. And so I didn't have a slide deck, for that. So although I've been doing it a long time, since 1998, originally with Patty Bobryk. And so I called my mentor, who Patty knows, June. And June is the mother of MS. She started the consortium and started the IOMSN, the International Organization of MS Nurses. And so I said, June, do you have slides? So she sent me like about 10, and I had to kind of narrow it down. But so I titled it, It Takes a Team. So I just want to go over, how many of you are new to the world of MS, if I could see you? Anybody in here newly diagnosed, okay? Anybody else? Okay, so what I always do at any program that I'm asked to speak is, if possible, I like to talk about a little bit about MS, so that if there's anyone here that is new to this world, and of course it's a review for some of you that have been around a long time too, but we do know that MS is immune-mediated, meaning that it is an autoimmune disease of the central nervous system. It is both inflammatory, causing those lesions along nerve pathways in the central nervous system, and it's degenerative, which means that you can actually lose your axons, which leave on an MRI an area of hypointensity. So the a pathologic hallmark of MS is those lesions that we see on MRI. We now know that not only are the axons or the myelin targeted, but the axons themselves can be targeted. The cells that make healthy myelin, the oligodendrocytes, can be targeted. And also that MS is in the white and the gray matter. So it is the most common chronic neurologic disease of young adults in our country. So this is a schematic. I'm not going to go over that. Don't get nervous. But this is a slide that I love to use when I'm teaching nurses about MS. But this is not the most complex one. This is somewhat incomplete. They have severely more complex ones that we've seen throughout our time at the consortium and sharing with other individuals in the world of MS. But if you look right here, this is a picture of inside the central nervous system. This is a neuron. So this is the nucleus here, this is the axon, and the stuff that is wrapped around the axon is called myelin. The purpose of the myelin is to keep the axon safe and to speed up electrical conduction systems. So these little B cells and T cells that are running around there, they're trying to demyelinate that axon. And these are oligodendrocytes. They actually make healthy myelin. And so sometimes they're targeted, sometimes the glial cells are targeted. So it's very different for every individual. So what causes MS? Very briefly, we don't know. But we do know some things. We do know there's a genetic predisposition, but remember, there's no one genetic piece. We may have over 200 different genetic pieces. So what causes your MS is going to be different from someone else in the room. Everyone's different. There are environmental factors. There are viruses that may start that trigger that leads to MS. Low vitamin D, where you grew up the first 15 years of your life. Smoking. Smoking is detrimental to MS. Smoking, whether you smoke 6 cigarettes a day or you smoke 2 packs of cigarettes a day, can put you in a more progressive phase very early in the disease process. Obesity is another factor that's they've found out that children who are obese are more likely to get MS, and obesity is not good for you anyway. I mean, I can attest to that. But still, we should all try to stay within our normal weight. Diet, salt is toxic. It's inflammatory. I just heard recently sugar is inflammatory. So if you're a sugarholic like me, you need to cut back on that sugar. And so then they've learned that the microbes in the gut, in the stomach, can also lead to MS. And then because of these two factors, there's immune dysregulation. And so your immune system gets confused and you develop that autoimmune process. And remember, we've talked about immunosenescence recently, but the aging immune system doesn't work as well as you get older as it did when you first were born or you were a teenager. So, and the more autoimmune diseases you have, the less efficient it's going to work. So your body is going to respond differently. So these are just different pictures of lesions that we see in the central nervous system from MS. This one here I just want to bring to your attention. I can't really point to it, but these have 3 lesions. These are all up and down the spinal cord from the cervical cord through the lumbar cord, and there are 3 lesions. I hope you can see those, but they don't block the entire cord. Look at this lesion here on this one. This is a lesion that's long, it's high in the cord, and there's no way to get through that lesion. Therefore, anything below that area is going to be affected by MS. The symptoms that occur with MS are going to depend on where those lesions occur in the central nervous system. You have about 14 billion nerve cells in your nervous system, give or take a few million. And so one lesion, one 5 to 7 millimeter lesion, which is the average size, can hold 10 to 12,000 axons. And so when we're not just talking about one axon being demyelinated, we're talking about tens to thousands. So where they occur cause symptoms. I don't have time to go over these, but I will say these are the most common symptoms that occur with MS. And generally, an individual may have 5 or 6 of those symptoms through their lifespan. We very, very rarely see a person that comes in and has every symptom that can happen with MS. So these are the medications, and and Tricia as well as Patty is too, but we're very pro-treatment in MS. And now that we have a treatment for primary progressive MS, we're even more pro-treatment. We believe that everyone that should be on treatment should be on treatment. But still we find that 60% of people with MS do decline treatment, and that's unfortunate. But we have 13 different drugs, and with the different dosing options, we have about 16 options for MS, and there's a drug in that group for just about anybody. The factors that influence how we decide on treatment is going to be twofold. It's going to be our opinion and the patient's considerations, and then we talk to the patient. Ultimately, the patient makes the decision. We want them to have that right to make their own decision, but we're going to consider their burden of disease. How many lesions do they have? How many relapses have they had? What about immunosenescence? What is their immune system? How is it functioning? And then what is their disease course and what type of MS do they have? And then from the patient's perspective, we look at their lifestyle. Do they have realistic expectations? Do they know what to expect from treatment? And we want them to certainly have a support system, and of course financial support is important. Okay, so there's my basic. So comprehensive care has been defined by the Consortium of MS Centers as as an organized system of healthcare designed to address the medical, social, vocational, emotional, and educational needs of the patient and their family. We tend to take a more holistic approach, and we take care of the whole being. Now, some centers have everything in one place. Our center does not have everything in one place, so we have developed relationships out in the community. We have, besides Patty and her staff, we do use other physical therapists, and depending on where the patient lives, and we've developed those relationships. But it's important, whether it's an MS center that's comprehensive with walls or without walls, the goal is the same. Holistic approach to treating the whole person. We want to slow the MS disease course. We want to treat relapses. We want to manage symptoms. We want to improve function and prevent progression. We want to address all safety issues, address emotional well-being, embrace a philosophy of empowerment. That means empowerment of the patient to take control of their disease. And we do that through a lot of education and support. And recognize the patient is in the center of the team. They are the number one person in the team, and they really have the decision-making with us. That is their right to do that. So the CMSC did a white paper in 2010. Patty, you were part of that group, were you not? They did the white paper. And it was a consensus statement, and it defined again the comprehensive care, but it said a key to that is coordination of health professionals. And so there are a lot of people, that's why I named this It Takes a Team. It takes a lot of people to take care of a person in a comprehensive way. But the care must be individualized, and it must be pertinent to the patient, because every MS patient is different, and one size does not fit all. The objectives: to diagnose and confirm the diagnosis of MS. You say to me, if I come to you and I've been diagnosed MS, are you going to re-diagnose me? No, but we're going to make sure that that diagnosis is correct. Patty knows Victor Robert is he's retired now, but we love him dearly, and he worked with us for many years in MS work, and he told us that there's a paper out there that says about 25% of all people diagnosed with MS were misdiagnosed. So when you come to a comprehensive center, they're going to make sure that you have the diagnosis of MS. And we're going to treat the relapses and those episodes, and we're going to modify, if we can, the disease, and we're going to make medical treatment and management of MS-related symptoms. We're going to promote mobility and minimize the effects of secondary and tertiary symptoms. So our goal is to maximize functional ability and to take care of the patient and the family. The families are very special to us. They're the support and the co-supporters in the family, and for the patient, they're very important. So we take care of the patient and their support person as well. So, and then we network with other community resources and obtain appropriate services. as much as we need. So the team objectives, we sort of talked about them, but this is the team. Now you'll see variations of this. The ones that are highlighted, I just highlighted them today because I thought they were the primary team. Your neurologist, and of course your nurse or your nurse practitioner, your physical therapist, your occupational therapist, your social worker, your speech pathologist, your psychologist or your neuropsychologist are all core members of the team. And these other members come and go as we need them. So we're going to invite an orthopedist in if we need them. We're going to invite a urologist if we need them. And so, but those people will come and go. But the core team is going to always be there for you. There are many learning needs for the MS patient and the family and the children of people with MS. And I can't go over all of them, but I will say that in order to attain teaching families and people with MS and meeting all their learning needs, we do have to engage all of our team. So if I send a patient to Patty for physical therapy, I know she's going to regurgitate the same thing I'm saying every visit. Are you on treatment? Are you taking your treatment as prescribed? Have you missed any doses? She's going to do that too. We all have to speak the same language, and we all have to constantly be in a mode of meeting those learning needs. The team leader, of course, is a neurologist, and there are some family doctors out there that like to diagnose MS. We reserve that in our practices for the neurologists. Some nurse practitioners can diagnose MS as well, but the neurologist is the number one. He orders and reviews diagnostic testing, and Tricia and I do that too. So many of the things on this list that he does, we do as well. And so, and then of course in my practice and in many other centers, we do clinical research. You don't have to do it, but we like to do it, and so we have probably 5 or 6 clinical trials going on right now. Tricia, I know you have more. So this is just a model of MS nursing, because MS nursing has taken on a whole scope of care for the MS patient. We know we have to establish care, we have to continue care, and we have to sustain that care, regardless of what type of MS the patient has, regardless of if it's a newly diagnosed patient or if it's a patient that's at the end of life. The care is the same for all patients with MS. So we're going to build that relationship. We're going to have open communication. We're going to share information. And those of you that know me know I'm not difficult to get in touch with. Everybody, I think my phone number is on the internet, actually. And so we're going to share information. We're going to be there for you when you need it. Share sustaining care. We're going to ongoingly provide education, moving towards a sense of well-being. We're going to identify community resources, and then we're going to continue that care as time moves on. And we want to manage symptoms, encourage self-care strategies, and monitor adherence. So most of the time people don't like to talk about adherence, but it's very important, not only in taking your treatment, but in being a part of the team and being a part of developing a plan of care. Lifestyle medicine is something that has taken on over the last couple years in our practices as MS centers to help using evidence-based medicine, encouraging patients and families to adopt and sustain healthy behaviors, whether you have some level of disability or not. Everyone can take on healthy behaviors, and that can improve their quality of life. So we want our patients to get all those health screens. We don't want you to miss a mammogram or miss an exam, ladies, with your gynecologist. Men, your primary care doctors need to look at those PSAs and so forth, and everyone needs to be screened. We want you to have a diet that is appropriate for you. We want to improve nutrition. We want to reach ideal weight. We want to increase physical activity. We want to eliminate tobacco use. That's really bad for MS, and we want to use alcohol moderately. Some of you may think, well, gee, I'm doing that already, but you'd be surprised at some of the improvements you can make. And if you want to go on the CDC website, Centers for Disease Control, and they have all these tools and mechanisms. You can print them out, and they tell you how to live a healthy lifestyle. So some primary doctors are taking on this goal of living well and living well and having a healthy lifestyle. And so if you're in one of those practices, they have a very specific focus, and good for you if you're with that doctor. Neuropsychologists actually do cognitive screening. They do neuropsych testing. They communicate the results. They're trying to find out how is the patient cognitively declined, and how does it affect their life? How does it affect their ability to take care of themselves? How does it affect their ability to make decisions about their MS? And what can we do to help? That's what they do. We actually have Dr. Maroof in our office, and he works with us very closely. He plans and participates in cognitive rehab, although our rehab friends do that as well. He can direct counseling and referrals, and he does work with families and do interventions with families as well. And then we have psychosocial needs are met by psychologists, licensed clinical social workers, licensed clinical counselors, because 70% of all MS patients are going to have depression at one time or another. So we would prefer to put you in counseling and give you an antidepressant, because those are most effective together. They help you adjust to your diagnosis and adjust to progression of your disease. So it's very important that we include them as part of the team. And then when do we implement? Are you telling me I'm almost, are you talking? Okay. So I can't stop talking. So anyway, when do we implement rehabilitation specialists? Well, one thing I learned from Patty Bobryk in 1998 was you initiate rehab services at the time of diagnosis. And so at the time of diagnosis, we want them to have a baseline evaluation so that we know where we go from here. So they will find what patients need at that time, and then if things change, we often will send them back to her. They'll do a workup on patients when they've had a relapse, acute relapse, or even during or maybe following exacerbations. They'll do episodic functional assessments, especially if patients are progressing. And then we like our patients to have annual updates, because you may think you haven't changed, but when we haven't seen you but every 3 to 4 months, we may see changes that you don't realize. And so it's really important for you to follow up with our rehab folks. Physical therapists, now if I don't get this right, I know I'm going to hear from Patty. So physical therapists work on mobility issues and general conditioning, endurance, fatigue management, and they also work on pain management. 10? Okay. So one time we were working together in the old days, I called them, and we had a patient come in a scooter. He was a young man. He was about 34 years old. And he was in such terrible pain. His legs were having spasms, and he couldn't walk. And so before we put him on any medication, we sent him to our rehab people, Patty specifically, and the occupational folks as well. And they really got him moving, and they alleviated all his pain without him having to go on medication for pain or narcotics. So they have done, and I see them do remarkable things for patients who have pain syndromes. They do work on the gait, whether it's spastic or whether it's weakness. They recommend adaptive equipment and provide that adaptive equipment and assistance. Okay. Occupational therapists have a very unique role. They work on adaptive equipment and how the patient is functioning in their environment. And they do home evals as well. So they work on fatigue management, they work on safety, making sure you're safe in the home, driving evaluations, cognitive evaluations, and they do work on the upper motor, the upper part of the body. Speech and language pathologists work on swallowing. They also work on speech deficits. I've heard more patients recently with relapses are having slurred speech. And we didn't used to see that too much with MS, but we're seeing that more, and it's very important if that continues that they see a speech pathologist. Hypophonia, a lack of voice coordination. Some of you have heard people who don't phonate well, and that can be part of MS. So they work with those with low voice quality. They work with patients on communication and communicating with with others. And then they also do cognitive evaluations and retraining. Other team members can be urologists, orthopedists, as I said earlier, social workers. We do not have a social worker in our office. I wish we did. We do know a few in the community, but social workers are very important. Clergy is always important. And if you don't attach yourself to a particular faith or religion, that's okay, because your friends and your support groups can fill in. Case managers are part of the team when you have a case manager. And then those community organizations, and you know I highlighted MS Views and News, because MS Views and News provides you with a lot of education and a lot of information. And you should visit that website. If you're not getting the newsletter online, then you should go to that website and sign up to get it. They're also members of the MS Consortium and the MS Coalition. So believe me, Stuart is out there. When I knew him a few years back, he was only limited to South Florida. Now he goes throughout the United States and educates patients and families. And, of course, the other organizations as well. Those of us that are in MS centers, we know these organizations well. We work with these organizations, and they supply us with education material for our patients. And they also, we write letters to them to get grants and whatnot for adaptive equipment, wheelchairs, cooling vests, and other things. So we have a connection with them. And then the family needs. The care partners. It is so important that we recognize our care partners and all members of the team, of the family, whether they're children or care partners. So we want to help them help their loved one in preventing, where was I? Okay, family needs. We know that there are changing roles, and roles are going to change over time. And so we want our care partners to be, and our patients to be prepared for that. We want to help them address economic issues that may come up and help them with the education of children and answering those questions. Reproductive planning. I just had 2 women this week told me they're young women, they are married, it's not married too many years, and they say, we're not going to have children because I have MS. That is a personal decision. It does not have to be the decision, and we encourage women to have children if that's what they want to do. But a lot of people are just making that decision, and that's certainly a personal issue. So the needs, we have to recognize the needs of a growing family, and then we have to look at aging. This past year, I've had to recommend, assistive living for several of my patients that have been with me for over 20 years now. And it's very difficult, but you have to be strong. You have to tell the truth. You have to talk to the family about that, why that person may not be safe at home, what can be done to keep them in the home, and if that's not adequate, maybe placing them in assisted living. So comprehensive care is more than treating the disease. It's more than writing a prescription for medication. It is preventing disability, as I've said before, and improving function. And all the things that I've talked about tonight is being in tune to the mental health concerns, being in tune to the psychosocial issues, being in tune to the patient as a whole being. Okay? General patient advice, and I'm almost done, is that MS is a lifelong disease, and treatment is a lifelong commitment. So if you're young and you just were diagnosed with MS, make a commitment now to be part of the decision making. It's called shared decision. You and your healthcare provider make those decisions together. Take on MS. Do treatment if it's recommended for you, and so forth. Keep those appointments. Always go to your appointments. Be adherent to the treatment plan. Communicate with your healthcare worker, regardless of what it is. My office is a safe environment. Patty's office is a safe environment. Tricia's office is a safe environment. So we talk about everything. And if you don't bring it up, I'm going to bring it up. So make sure that you have that open communication. Find a strong support network and implement a health and wellness approach. Keep that high blood pressure in check. Keep that cholesterol normal. Make sure your blood glucoses are well within normal limits. Exercise, eat right, drink water. We don't drink water. I think if we drank water, we'd feel a lot better. I've been sick this week, and I've been drinking a lot of water. I feel better already. So, and stop smoking, and then be involved socially with your support groups, your church groups, and whatever, and manage that stress, which is everywhere. So, this is Susan Anspach's Dimensions of Wellness, and you can see there are 6 dimensions in her diagram. And when I saw this for the first time, and she writes a whole book on it, so there's a whole book. I own the book, and I love the book. So when I saw this, I thought of that old Chinese proverb that I had heard. You know, it says, the body is like a house of many rooms. And to be truly well, to be truly happy, you have to spend time in each one of those rooms. In this particular, it would be time in each one of these dimensions. Because if you neglect one, you're going to neglect all of them, and your body won't be truly well. Okay, so thank you very much.
All right, our next speaker is Patty Bobryk. Patty Bobryk, come on up, but she's received her physical therapy degree from Wayne State University in Detroit, Michigan, and her master's degree in neurodysfunction from the University of Florida. Since that time, she has worked exclusively with persons with multiple sclerosis at the Orlando Health MS Comprehensive Care Center. She's a certified MS specialist as well as an assistive technology practitioner. Patty is an active member of the MS Society's Mid-Florida Healthcare Advisory Committee and provides educational seminars for professionals and patients nationwide on rehabilitation and multiple sclerosis. She's the co-chair of the International Organization of Multiple Sclerosis Rehabilitation Therapists and is the current secretary for the Consortium of MS Centers. Let's welcome Patty. Thank you much.
Great. Thanks, Stuart. Well, I'm a roamer, and I'm told that it's being filmed, so I'm being limited to this space. So if I get out of line here, they're going to be pulling me back with the hook. But I wanted to thank Stuart, first of all, for putting on this educational seminar, and I wanted to thank everybody who's here tonight also for coming. There's so many familiar faces in the audience, so I feel like it's always coming home. So really appreciate that. Wanted to thank our financial supporters, and on a personal note, I want to thank my mom for being here. I've been in PT practice for over 30 years plus, and this is the first opportunity my mom's had to hear me speak, so it's pretty special. She's visiting from Michigan. She's been here for 6 weeks, so it's been really nice. Nice to have her. So Stuart charged me with talking about movement in MS, talked about mobility versus immobility, about pain, and about physical functioning. And each one of those topics, I could talk about 8 hours on any one of them. So to condense it into 30 minutes is really going to be a challenge. But we'll do the whirlwind tour, and we'll leave any questions you have for the Q&A. So there is good and there is bad about not moving. So I want to go over, first of all, what's the good? We usually think of immobility as being something bad, but there are good points to having rest or immobility. It's very restorative, meaning that our body has a chance to regroup and recuperate. So if you think about what you need to do after surgery or trauma or injury or a lot of stress in your life, you rest because you need to recharge those batteries. So that's, that rest is very restorative. It also can reduce pain. So think about if you have a sprained ankle or a sore elbow or a sore shoulder. What did they tell you to do? Well, you need to ice it and you need to rest, right? So that can be very beneficial for some injuries that you might have that are related to pain. Also, when our body is under a lot of stress, rest is good. If you've ever heard people say, oh gosh, I've been so stressed and now I just want to put my feet up and relax. That kind of, again, recharges our batteries. So rest is very important for that regeneration or restoring our reserves in our body. I also put in this is regarding sleep, because I think that a lot of us are underrating the importance of good quality sleep, so I'm putting that under rest too. There's a lot of research out there now to say that if we don't have good rest, good sleep, it's bad on our heart. We put on weight if we don't have good sleep. It affects our immune function, which is particularly important for MS, and also impacts our cognitive function, our memory. So think about when you've been sleep deprived. Are you usually on your game? You know, you're not on your game. So these are all important things that rest does for us. So those are all the thumbs up. Now for the thumbs down in regards to immobility. Well, what happens when we don't move? We decrease our metabolism. So we're not moving around, we're having a slower metabolism, things aren't, churning the way that they should, we put on weight. It also affects our fluid and electrolyte balance. So if you've ever been in a position where you've, say, had your feet down in a dependent position for a long time, what happens? Your ankles swell? Right? So you hold on to that fluid because your muscles act like a pump. So if you're not pumping that fluid up and through the rest of your system, you get out of balance and you'll be holding on to fluids in your body. It can happen anywhere in your body. Also, when we don't move around, what happens to our GI system? It slows down and you get constipated, right? Yeah. So moving around is really important for not only, your endurance and all of those things, but important body functions too, lungs included. Orthostatic hypotension, do you guys know what that is? That's that feeling when you're lying down and you get up quickly and you get the woozy head. Well, when you've been down for a while, your body thinks that that's what's normal for you, and it adjusts its blood pressure and your body functions to that. So every time you sit up or you stand up, you go, whoa, I'm going to pass out. So it's important for that mobility to keep those important body functions going. You're at risk for blood clots if you're not moving around. You're at risk for losing muscle mass when you're not moving around. The old saying, use it or lose it, is pretty true there, okay? You also lose bone density, so your bones weaken over time if you're not using them in a weight-bearing position. So a lot of times, even if you're a primary wheelchair user, it's really important to get up in a stander or do some standing, because that, besides helping all of your body functions, helps keep your bones strong. Our urinary tract kind of gets clogged up too if we're not moving around. It can cause depression, you're at risk for pressure sores, pain and contractures, and you're going to see these themes come up again and again, and how immobility can cause some of these things and how movement can make them better. So one of our mentors in the MS world, who many of you guys know, Dr. Randy Shapiro, he says the solution to immobility is mobility. So what do we do for immobility? We move around. And so, to that end, right now, we're going to move a little bit. And I'm here to tell you that it doesn't take a lot. A little bit adds up. So right now, what you're going to do, you've been sitting a while, you listened to Connie, you had a great talk, you were very engaged, but you're kind of getting like bored, and not bored, but stiff from sitting there. So let's all do some shoulder rolls, okay? So let's just move around a little bit. If you can't do a shoulder roll, try to bring your shoulders up, hold it, and then relax them down. Bring them up and down. One more time. Up and down. Good. If you've been in therapy with me before, I'm a big proponent of moving. And, a lot of us are TV watchers. And you're like, well, I'm just watching TV, passing the time, I'm relaxing. But every commercial, if you do something, if you move something, all of that time is going to add up, and you're going to really have had a lot of good movement if you just do something every commercial that comes on. Unless you're streaming something and there's no commercial, then you have to stop. So there are reasons that you might be immobile. A lot of the symptoms of MS can cause immobility. So if you're fatigued, you need to rest, and we educate you on that. We want you to rest because pushing through that fatigue is not a good thing. If you're weak, if you have sensory issues, if you have pain or spasticity or depression, any of those things can cause you to be less mobile. There could be limitations in your environment. So let's say that you're using an assistive device and your home isn't set up for it, and you have very narrow spaces and there's a lot of rooms that you can't get into. That may be a limitation, or it might be a bigger limitation that you can't get into your work environment anymore because now you're using a power chair. Or it may just be that, you know, the surfaces that you're trying to ambulate on, or you're in a multi-level home and you can't get up the stairs. Those may cause some limitations in your mobility. One big factor that we sometimes forget to really closely address is that if you've fallen before, or you've had what I call near falls, where you're not quite going down to the floor, but you might grab yourself and hold on to the door jamb or a counter, that really can kind of play on you, and psychologically you can have this underlying fear of falling. And then you start making your world a little bit smaller. Well, I almost fell when I walked to the mailbox, so I'm not going to walk to the mailbox anymore. Or I almost fell when I went to church, so I'm not going to go to church anymore. Or, you know, it's a slippery floor in the foyer of my home, so I'm not going to go there. And that can really kind of start making your world smaller and making you more or less mobile. So what can we do? So, you know, we want to refer you to the rehab team so we can really kind of investigate what the problem might be and develop a treatment plan for it. And what's the treatment plan? Movement or exercise. So if you come to see me, or you come to see any of the other professionals at our team at the MS Center, you're going to get a home program, I promise you that. And it's going to include stretching, it's going to include strengthening, something cardiovascularly, something for your stamina. You're going to get some balance exercises, and of course we're going to work on function, meaning walking and transfers and all those things that are important in your life, stair climbing up and down from the floor, whatever it might be. So I just want to go over some of the components very quickly of the exercise program, so you kind of know if you're not exercising, which, let me just poll you guys. Who's on a regular exercise program? Good job, guys. Good job. Who's thinking about wanting to be on a regular exercise program? Because you know what? You have to prepare yourself for that. You know, you kind of have to psych yourself up for that, and you have to start somewhere. And if you're thinking about it, that's a really good thing when you're one step closer at getting there. But one thing that we always give for anybody who comes into the clinic is a stretching program. Low and slow, easy. It's not this big aggressive stretch where you feel like, oh, you know, it hurts so bad, scrape me off the ceiling. But you want to stretch discomfort, and we really do a good evaluation to determine which muscles need to be stretched. If you have any spasticity, that abnormal stiffness in the muscle, that's really the number one way to kind of address that symptom before we even start you on medications. I recommend that you do stretching daily, and you don't have to get on the floor. You can do a seated stretching program. There are a lot of ways to get around those programs, make it easy for your lifestyle, whatever you need. We also give you a strengthening program. The most important thing you want to take away from a strengthening program is, you know, if you go to the gym or you've worked with a personal trainer, they might say, well, you need to do 3 sets of 10 of this or 3 sets of 15. And that doesn't hold true in MS. What your parameters are always repetitions to fatigue. And the reason for that is that you are working with a problem in the transmission of the messages from your brain to the muscle, okay? And if you lose that transmission or it gets short-circuited, that's the only thing that can make that muscle contract. So if you fatigue after 5 or 8, or you've lost that transmission, and I've told you to do 15, what are you going to do? Well, you'll end up substituting another muscle, you'll overwork the muscle, and you'll end up over-fatigued, and you'll have a long recovery time. So it's always by how you feel, repetitions to fatigue. And you want to target the muscles that are going to give you the most benefit. So that's, again, where the evaluation comes in, because you can do a general strengthening program, and it'll be wonderful for you. but it might not be addressing those muscles that you need most for the goals that you have. So if your goals is to improve your walking or to improve stair climbing, there will be specific muscles that we're going to make sure that are nice and strong for you so they can support those goals. And don't forget to strengthen the core. We always forget about the core, and it's really important for balance. Our arms and legs don't work well if we don't have a strong core either. Aerobic conditioning. Now, you're going to think, gosh, Patty, I have MS fatigue. That's a real symptom. It's a real entity there. And now you're asking me to do something aerobic to expend more energy. Where am I going to find that? But actually, the research shows that if you do light exercise, you're going to actually have more energy. And you might experience that. Say that you're like, oh, I really feel like I don't want to do this. I feel really tired. But let me do a little bit. And you do a little bit, and you might feel a little bit energized by it. So it's a real entity. You want to make sure that you're doing an activity that suits for you. I get a lot of suits you and your lifestyle. I get a lot of questions about, I hear that swimming is the best exercise for MS. And it is a great exercise, no doubt about it, as long as you're in a cool pool. But if you don't have access to a pool, or you don't know how to swim, or it takes all your energy to get to the pool, get in your bathing suit, get into the pool, get out of the pool, out of the wet bathing suit, back in the car, drive home, then that may not be the best exercise for you. So we really want to investigate what's going to work best for you. And an intermittent exercise strategy is always the best. So, we used to say, you've got to do 30 minutes of nonstop activity to get a really good aerobic workout. And we know otherwise now. So even short bouts of activity interspersed with rest is beneficial. Those minutes add up. So say you want to ride a stationary bike. You can ride 2 minutes and then take a 3-minute break and ride 2 more minutes and do a 3-minute break. That way you'll get more minutes, total minutes, and not be as fatigued, because there's no sense in over-fatiguing yourself, particularly if you have a long recovery time from that. So we want to manage that fatigue well and not over-fatigue you. Balance retraining. Important piece. We don't want anybody to fall. Fall is a 4-letter word in rehab here. You have to do activities that are challenging enough, but you have to do it with control. So if you think, okay, well, I'm going to stand on one leg as my balance activity, and if I'm all over the place, what are you teaching your body? You're teaching your body to be all over the place. You haven't done anything to improve your balance. So you want to be able to take a little bit of support and make sure that you can do the activity with control and then start taking away the support. And before we leave this section, I just want to say that for your mobility, it's really important to consider equipment. And I'm not going to go over the equipment, but I want you to think about being open to it. Quite frequently, people will say to me, well, I don't want to use a walker or a cane or a wheelchair because it means something, that people are going to think that I'm not as intelligent as I am, or I just don't want to be seen in the community with them. But you have to think what's going to work for you and what's right for your lifestyle and what's going to give you greater independence. So if you end up using a cane and you can walk through all the aisles of the grocery store or the mall or be out with your grandchildren or your children, and you can do that with good safety and less fatigue, then you really need to consider that. So it's a big step sometimes when you have to use an assistive device, but you want to have some advice about what the best assistive device and what's right for you is, so that's where the rehab team comes in again. Okay, so we're going to talk a little bit about pain, and earlier on in the disease, back in the 80s, we thought that there was, or we were told that there was no pain with MS, that it was a painless disease. If you don't mind, who has pain with their MS? People? Yeah, right, yeah. Who says it's a painless disease, right? So the stats are that 2/3 of people with MS at some course in the course of their disease is going to have pain. It can be a result from the disease itself, or it could be a consequence of some of the symptoms and the sequela of some of the symptoms. The good thing is that even though pain is a very disruptive and nagging and negative symptom, it doesn't predict a poor outcome of the disease. So, pain can be very disturbing, but it doesn't mean that your disease is worse. When we talk about pain, it can come from different sources. Dysesthetic pain, it's that burning, electrical pain. It could be numbness. It could feel like a deep bone pain. When we think of pain, we usually think, oh, well, we'll take some pain medicine. This doesn't respond well. This type of pain doesn't respond well to typical pain medicine. That's when you go see Connie and Trish, and they talk about some other options for you. Spasticity, that abnormal stiffness, is painful in itself, especially if you have active spasms. You lie down in bed and your legs are just jerking, kind of like almost like restless legs. That can be very painful. And you can have musculoskeletal pain too, from poor positioning, from any number of things. Weakness, stress, abnormal stress on the joints. I use this example all the time, but let's just say you have a little bit of weakness in your foot, okay? And you've decided, well, I'm just going to deal with it. I'm not going to get a brace. I'm just going to deal with it. And you change your walking pattern. So instead of walking with a normal step, what you do is you hike your hip and you swing your leg through, okay? So you're doing a lot of that. What do you think is going to happen in the long run with my back? Okay? Yeah, you're going to have a lot of back pain because our backs weren't meant to do that over and over during the course of a day to have that walking pattern. So that can be painful, and that wasn't because you have a back problem. The back problem was caused because you had weakness in your foot. So what needed to be addressed early on was the weakness in the foot, so you didn't have a compensatory strategy that caused more problems down the line. You can have pain from steroid-induced osteoporosis, disc disease, any number of things. So what do? Well, you see your lovely PT down the road. We do an assessment and we see what kind of interventions are appropriate. Sometimes non-steroidal anti-inflammatories are prescribed. I just don't use heat anymore in my practice whatsoever. I only use ice. It has the same benefit and it doesn't cause that overheating that can be detrimental to your symptoms in MS. And exercise. Exercise, that movement is really important, but done correctly. If you're somebody who doesn't change their position very often, either for their whole body or just an extremity, changing your position is really important to get rid of some of that pain. Or maybe you need more support, or as we talked about earlier, preventing something that could happen down the line because of a compensatory strategy. So guess what? We're going to move again, all right? So what you're going to do now is you're going to, if you're able to, if you don't have bad shoulders or anything, you're going to reach up like you're going to pull down a rope. So pull it down, and then the other arm, stretch up and pull it down. Good work. Stretch up, pull it down. One more time. Stretch up and pull it down. It's as simple as that. All right. My last little section here is talking about restoring physical function. And what I really wanted to highlight here is that there's a lot of good studies that are being done right now about how movement, how exercise can be so positively impactful in ways we didn't originally think about in MS. So there was a study just this year that came out that said light physical activity demonstrated improves physical functioning in MS. You know, we've kind of known that all along, but we haven't had the research to back it up. And, you know, if you've been living with this diagnosis for a lot of years, you might have been told in years back, well, you know, don't work out too hard and rest a lot and don't move too much. That is not our current thinking, and we know better than that now. Exercise can also improve sleep and may improve cognitive and physical functioning. That was a study from last year. Aerobic exercise, so that cardiovascular exercise, can help reaction time in memory test. So, you know, that stimulation that you get from moving around can help with your cognitive thinking. So that's really important if you feel like, oh gosh, I really want to try to preserve my thinking skills as much as I can. Aerobic fitness is associated with positive brain changes, and that was a little bit earlier study. But, it just talks to the point that movement and mobility is really important for your overall health and well-being in MS, for symptom management, and for your overall health, because as Connie was saying, is that we're looking at the whole person, and we don't want you just to be a laundry bag, a laundry list of all of your symptoms, but we want you to live well. And whether you have MS or you don't have MS, these are the things that you need to be doing for yourself. Stop smoking, drink lots of water, exercise, get some really good rest. So what are my recommendations? Do some exercises every day. The little saying of no pain, no gain does not apply to MS, okay? You don't have to push through it. You want to use an intermittent exercise philosophy and listen to your body. So our last movement, if you're able to, under the tables there, I want you to pump your ankles. So I want you to just pull up your toes if you can, and then push them down. Pull up and push them down. 2 more times, pull up, push them down. Last one, push them down. Thanks for your time and attention. Appreciate it.
Thank you, Patty. Yeah, that's good. Thank you, Patty. Thank you very much. That was great. Oops. So our last speaker or last presenter will be Patricia Pagnotta, and then we will do the Q&A. Patricia Pagnotta, a nurse practitioner, ARNP, MSN, CNRN, MSCN. She is currently employed at Neurology Associates PA in the MS Center of Greater Orlando in Maitland, Florida. Patricia completed her undergraduate degree in Towson State University in Towson, Maryland. Her graduate degree was completed at University of Maryland, and she did postgraduate work at University of Central Florida. She is an active member of the MS community, currently serves on the executive board of the International Organization of MSRNs, which is IOMSN, the International Organization of MSRNs. She's the treasurer. She is a member of the Consortium of Multiple Sclerosis Centers, CMSC. Tricia published in MS in peer-reviewed journals and patient journals. Tricia has been active in research as a primary investigator and co-investigator on several clinical trials in multiple sclerosis. She is very active in educating on multiple sclerosis to peers and those affected by the disease, and have presented all around the country. She's an advocate to persons affected by MS and runs a monthly support group for MS patients in Central Florida at her center. In her spare time, she loves to be with family and animals. Let's welcome Patricia Pagnotta.
I'm going to try to behave. You wrote everything. I got challenged with putting all of this together, and I hope that the things that I repeat, that you appreciate the importance of anything that you have heard more than one time, because Patty is an excellent speaker. I learn something every time Patty speaks. I admire Connie tremendously. To get the 3 of us in one room any day is very hard to do, because I feel like they don't even live in my own state. So it's amazing that we are so fortunate in this area to have persons that have such passion for this disease. But the other thing is Stuart recognizing that and bringing us together. So thank you, Stuart, for that. But again, collaboratively, if you were to count up our years of experience in MS, I think we would be close to 100, if not more, years of experience in MS. So, that's kind of daunting. I'm standing back, whoa, but you should recognize that we did not do our talks together. So Patty created her talk, Connie created her talk, and I created my talk. So if you hear things once, twice, and me for the 3rd time, it's something really important. Okay, So I wanted to start with just giving you a resource. So this person I found to be very interesting. Her name is Joanne Lee Mustry. She received her PhD in clinical psychology. She delivered a daughter, meaning she had a baby, and she learned she had multiple sclerosis all within a period of a few months. She's a very successful psychologist. She works counseling patients and she works with their families. She has written 2 wonderful books. And so I encourage you, if you are a book reader and want to embrace your own physical health, that you look these books up, After the Diagnosis and Beyond Rage. She has helped thousands of persons who live with this disease and help their families. So I encourage not only those of you who physically have the disease, but those of you who are living with a person who does, that you look at these. And I can tell you from a healthcare provider's experience, I found these books to be exceptionally eye-opening. And there's nothing like being able to be in someone else's shoes. And so I just say that no more. So I develop my own things that I like to talk to persons about being successful. I'm here to put all the pieces together for you, and really the puzzle is only built around that centerpiece. Now, the centerpiece is the person who has MS, and I would extend that to the person closest to them. Many of us, when we put puzzles together, though, we put the corners together. How many people build a puzzle and don't start with the corners, the outside? No? Okay, a couple of you do. But I would encourage you, when you think about your own self, that you start looking at the centerpiece and then build out. So number 1, to be successful, you should think about being a forever learner. As Connie talked to you, as Patty related her clinical experience, and as I would tell you, the things that I learned through the years, the things that I continue to learn, this disease, we have not found a cure yet. We have not come up with the cause for MS. I don't know that we will ever come up with the cause for MS, but I'm hoping that we are able to put together a few things that we know will predict the disease. I am praying for a cure, and I want you to know that those of us who treat MS have no desire other than to cure this disease. So we have to be forever learners. You have to be a forever learner so that you are available when we have these technologies. I stand before you to tell you that there are 16 disease-modifying drugs. When I first started treating MS, there were no disease-modifying drugs. And there are 16 of them. And so the challenge really is, getting a person on a disease-modifying therapy. To think there's 16 disease-modifying therapies and 60% of persons don't accept a disease-modifying therapy, oh my gracious. So again, be a forever learner. Learn what you need to learn. And I would challenge you that learning is good no matter where you get it from. So Stuart and his organization through MS Views and News is an excellent source, because not only does he have a website that keeps you very up to date with all of the research, but I give every new person that comes into my clinic one of his brochures. And what I tell them is, he has a YouTube channel. If nothing else, you don't want to do anything else, go to YouTube, because how many persons are not at some point wanting to hear what I said again, or wanting to hear what I said somebody else said? So you can go to that YouTube channel and you can hear different things. And when we talk for MS Views and News, I tell persons we are not being held to the restrictions that we might be if we are talking for a pharma company. So again, get your information from a variety of sources. That's a good resource. The other organizations are good resources. Your own community, persons in your support groups are good information, but you always want to check that, making sure that you're not taking just some of those things that might be blogs. But again, whether it's factual or not, and you're hearing it from somebody else, just appreciating the journey that someone else has been through, that's a learning process. So I encourage you, again, to be a forever learner. Don't delay a disease-modifying therapy. I can't emphasize that enough. In the years that I've been treating multiple sclerosis, it saddens me when I look at someone and think, man, if I had only, or if I had this, if I had that. We don't have a crystal ball. All I can tell you is that if you are watching your report card, are you having relapses? Is your MRI changing? Are you becoming more disabled? If you are watching your report card and you add into that report card your ability to tolerate a medication, then you have a complete report card. If you're not getting straight A's on your report card, you need to talk to your healthcare provider. What we do know is that the first 5 years are the most predictive of disability. And when we talk about those 60% of persons that don't accept a disease-modifying therapy, most of them occur in that first 5 years. Because most persons have remitting relapsing. How many of you, don't raise your hand, but how many of you thought when you had a symptom and it went away that it was something else? I hear persons all the time who come into my practice and tell me, you know, I had this before. And I had a healthcare provider who I diagnosed recently with my neurologist. This person said, I never had any symptoms before. I never had any symptoms before. Again, she said that to me about 3 or 4 times. And then we talked about some changes that she had in her ability to feel her feet. I'm like, what's that? Anyhow, so again, please, if you're going to maybe not accept a disease-modifying therapy, not in the first 5 years, and be with someone who is willing to treat you aggressively if that's what's necessary for the first 5 years, because that's what's going to keep you from becoming disabled. Track your progress. Again, you have to measure your report card. Make sure that you are looking at mechanisms for doing that. There are a lot of resources through MS Views and News. There is a Land of MS that Dr. Steingo created that you can go in and you can keep track of your health and things that are happening. There are, through other organizations, there are mechanisms for tracking through your pharma company that you're getting a disease-modifying therapy for. There's a mechanism for tracking. And do you know that your insurance company has a mechanism for tracking? Because what they'll tell us is about whether or not you filled a prescription when you were supposed to. Keep track of those things. Write things down. Journal. I encourage persons to journal like on a monthly basis, because persons tell me it's too troublesome to write down things every day. But just on a monthly basis, think about, well, what were you like last month? Or what are you dealing with this month? How well are you dealing with that? So again, make sure that you have a way of tracking your progress. And that needs to, again, be something that is beyond just you. When you're tracking your progress, you want to ask the people around you how you're doing too. So when you're writing a report, If I'm writing a report about multiple sclerosis, it's not just the things that I've written, I've published about. I go look at what other people in the community have done. So look and talk to persons around you. Treat yourself well. Have a healthy diet. A more plant-based diet we know is healthier. Low salt, good vitamin D, regular exercise. You should be getting 30 minutes of exercise at least 3 times a week. Now, some persons say, I can't do 30 minutes of exercise. Well, that's great. Do 5, 6 times a day. 30 minutes, however you get it in. We only know that for cognitive function and for depression, that 30 minutes all in a row is important, but other ways that you get 30 minutes, not. Again, I hope that there's not anyone in the room that is smoking, but I want to extend that to secondhand smoke. So if you have friends and they smoke, please send them outside, and then don't go outside and talk to them while they're smoking. Just because you're outside, you still can breathe in that. So you want to be far away from smoke. Alcohol is a toxin to the brain, so minimize that. And minimize drug use. So that is any drug, a drug that we can prescribe for you. Don't take it if you don't need it. A drug that you can get at CVS, a drug that you can get at Walgreens, CVS, or a drug that you can get on the street corner. So you want to use what you need and not more, because again, everything can be a toxin if not used correctly. Stay healthy. Make that a key that you are going to stay healthy, that you are more than a person who has multiple sclerosis. Multiple sclerosis is a rare disease. Make sure that you are attending to all of your other physical and emotional, those whole dimensions of health. Connie, when she was describing those healthcare providers for you, one of the persons that she had highlighted that she didn't verbally speak was your primary care doctor. Your primary care doctor is as important as your neurology team, because you need someone to look at all of those other things. So you need to stay healthy. You need to keep on top of with your primary care provider. Plan ahead, set priorities, keep goals in front of you, know what your limits are, conserve energy. Some people talk about spoons, however you do that, but plan ahead and manage your life. Learn to problem solve, define problems. You know, some persons, every little thing is a huge thing. Take a break, write it down. Get it down to something that's manageable. You know, the holidays are coming up. Oh, is that not a stressful time of the year? So what can you do? Well, start making lists. You know what, I was so excited I participated in Cyber Monday for the first time in my life. I'm like, woohoo! I was like, wow, make a list. You know what? What I find is that there are people that, you know, my son said to me the other day, talking to his new girlfriend, my mother puts up the tree every year. We're not allowed to touch the tree. And when you hear that, when you really hear what persons may be saying to you, recognize that other people want to help you. So again, define your problems, look for ways to solve those problems, be readily able to allow persons to help you, pick it apart. Don't try to do everything at one time. Again, accepting help. And so it's not a bad thing to need help. And it's a very good thing sometimes that you accept help, because the persons who want to help you are doing that because they love you. And so my son's going to help me put up the Christmas tree. He's not going to touch my ornaments that are 30, 40 years old, but you know what? There's tinsel to put on the tree. There's something else. So there's other things. Getting it out of the box is a big thing. Putting it back in the box. So think about that, ways that you can, again, making that list for the holidays. What can you give other persons to do? You're going to have the dinner. Do you have to do the whole dinner? Can somebody bring things, assign things? You have to be in control. Well, assign those things. And really, it will be much more rewarding. So really accept help, and then really thank persons who do help you, because they want to be acknowledged also. Learn to relax. So Patty talked about rest. And so rest is extremely important. Your mind needs to quiet down, but rest is important for allowing you to de-stress. So meditation, prayer, taking power naps, living one day at a time, listening to music. Do something that's fun for you. Playing with animals might not be something that's fun for some persons. But I can tell you, for me, there's nothing better than going out in the field and just standing there and have all my horses come up around me. But that might not be what it is for you. Find out what it is for you. Find out what makes you, life is good. And make sure that you do some of that on a regular basis. That should be scheduled just like everything else you do. Nature is a wonderful thing. I encourage persons to spend as much time as you can with nature. Stay away from too much computers, and especially at nighttime. If you have computers and whatnot, don't have them on in your room at nighttime. Make sure that you have a good and full life. Stay positive and hopeful. As I told you, over the years, we've had 16 disease-modifying therapies. I can't even tell you the amount of things that we've learned, but we've also learned a lot about managing symptoms. Persons who are diagnosed with MS today are way, way ahead of persons that were diagnosed years ago. Is there less progression in MS today than there was years ago? No. There's still a nasty disease, but we are getting so much further along, and so please always stay hopeful. Please always look at not, I can't go shopping, I can't do this, I can't do that. What can you do? I can make a list. I can write out Christmas cards. Maybe I can't write out 30 of them all in one day, but you know what? I only have to write out 20, so I could do 3 today. I could do 3 the next day. So please, again, break things down, be positive, add value to someone else's life. Sometimes that is the most helpful way to you stay helpful. Find somebody else that needs something and help them out. And I don't care whether you're in a wheelchair and can only move your mouth. There is something that you can give to someone else. And so I challenge you to find what that is that you can give to someone else, because believe me, what you give to someone else, you will get back tenfold. So I was also challenged to talk about emotional well-being, and one of the things that it's important to understand is your emotional well-being affects you physically, it affects your motivation, your attitude, your ability to attend to your health, it affects how you eat, it affects whether you exercise, how you relate to other persons, how intensely you intensify things, and whether you enjoy and engage in life. If you've had a really bad day and you come in here and somebody looks at you the wrong way, might you say something that you shouldn't say? I don't know. So attend to your emotions. Be calm. Get yourself together. Recognize that your emotional well-being has a lot to do with stimulating your immune system. So if for no other reason, you want to stay emotionally balanced so that you're not overly stimulating your immune system to always be trying to fight against something, which is, again, your central nervous system if you have multiple sclerosis. Focus on positive, stay centered, manage stress, practical solution-based problem solving, be mindful of your mood, build and nurture relationships, recognize family needs. I put LiveWise MS up here because LiveWise MS is a website that you can go to. It's sponsored by the IOMSN. It is a website that does nothing that puts on research and gives you information. It gives you information in a few different ways. So let's say you were to type in emotional well-being of family needs. There's 3 or 4 really good studies that are on there right now about the needs of support persons, caregivers for persons who have MS. So first thing you get is, well, why is this important to me? What were the key things out of this? What should I do with this information? You know, that seems very basic, but, you know, then, you know what? You can go to the actual article, and you would be reading the same article that I would be reading in a peer-reviewed journal. So it gives you a breakdown, it gives you the article, and then you can go back to applying that. And so it is a great place to look for, but there are 2 really good studies on family needs that I would encourage you to look at. So managing relationships, one of the things that gets asked of me most frequently is, should I tell persons I have MS? And that's asked in a variety of different ways. Am I still working? Should I tell my coworkers? I'm still dating. Should I tell somebody I have MS? Do I have to tell all of my family members? Maybe I was diagnosed earlier this year and it's Christmas time, and do I have to tell everybody? Well, it's a very individual decision. What I ask persons to think about is, once you say it, you can't take it back. So if you don't have to say it, but you want to say it, you may try testing the ground by educating. You know somebody that has this disease. Tell people about it. Tell them what it is. See what the ground is like before you start divulging your personal information. Because persons who don't know anything about MS, again, a rare disease, you tell them you have MS, they might think you're contagious. Or they might think you have little brain function. Or they might think that you're going to fall right out in front of them. And if it's your employer, they might think, well, you know, I don't know if I want to keep this person much longer. They're doing a great job now, but I'm going to be looking at this person a little bit differently. So think about that. There are resources to help you figure out whether you should disclose or not. And just make sure that you go through the whole process of pros and cons before you do. But it is extremely important, if you're having any difficulties, we can protect persons through FLMA if you're still employed and not disclose what your problem is. So you should recognize that we can, as your healthcare providers, protect your employment without telling them what your problem is. So protecting your employment and disclosing what your problem is are 2 different things. So please make sure you talk to your healthcare provider about that. So the diagnosis, family members get very confused. Again, this is a very unpredictable disease. You don't know how persons are going to handle this information. It's a very strainful thing on family members who are not close. And so even in family members that are, so be careful about that. The biggest thing is communicating openly and effective. The better you communicate, the more you communicate, the better your relationship is going to be. And recognize that there are financial considerations when you have a chronic disease, and that can be taxing on families. So the hopeful thing is that through good communication, you're building good roots for a tree that will grow very strong, a family tree that will be very connected. So it's important to consider that. So enhancing coping. How do you enhance your ability to cope? Educate, educate, educate. Share your feelings, struggles, set realistic goals and expectations. Seek outside help if needed. That can be support groups, clergy, professional counseling. Get physical help if needed. Explore financial resources. There are lots of ways. Again, this is a rare disease. At the MS meeting we had last weekend, we talked about how many more persons have MS than we thought. I don't know that that's a good thing. I like it being a rare disease. There's lots of resources for rare diseases. Reassure your family members how important they are to you. It's very important that you share that all the time. Recognize that roles in families are very different, and roles vary in this society compared to maybe traditional. So it's not unusual to have families be different, and so make your family what you need it, and adjust to the things that you can and can't do. Again, being open and communicating is the most important thing. So being willing to accept help, negotiate, and seeking resources. So this is one thing I like to end a lot of times with is, who am I in the face of this? And this is from Dr. Frankel. Everything can be taken from a man but one thing. The last of human freedoms is to choose one's attitude in any given set of circumstances, to choose one's own way. So I would tell you that the most important choice that you can make is to be a fighter, is to take what you have and make the best of it. And every day look at how can I be a little bit better. When it comes to any one thing, again, you might think I've got so many things. Work on one thing. If there's something that you heard tonight that could be helpful to you, maybe you heard 20 things. Again, work on one thing. Get that one thing down really good for a month or two, and then work on another one thing. So thank you all so much for coming. I am eager to be able to participate with Patty in the question and answer, and I really wanted to make sure that you guys had plenty of time for asking questions.
Thank you. I need you to take this mic. I need you to take this mic.
I got to take the mic now. I get to walk around.
She's got her own mic. All right, so what we're going to do is, first off, I have a question to ask before anything else happens, all right? How many caregivers are in the room? This is a question we ask at all of our programs. I would like to thank you all for doing what you do, and I hope that everybody in this room does as well, right? We ask this all the time because caregivers really need to be appreciated more than just by their own families, but by others just recognizing that they are doing that. And that is something that we like to do. So next up, we're going to run around the room taking questions, all right?
I would like to find out a little bit about magnetic stimulation, which was talked about last weekend at a consortium.
Magnetic stimulation. I'm sorry, I was having a hard time understanding what you said. So magnetic stimulation, there are different homeopathic groups that are using magnets as a way of challenging your current. And there are also different centers that are using not the MRI machine, but similar type of magnets to re-challenge your ions and things. And so that's where we're moving towards. But the most beneficial of what has been published so far is really in pain relief and helping with spasticity.
Patty, a long time ago in physical therapy, when I was struggling to go from not using a cane to a walker, you said something to me that completely changed my whole outlook. And that was, you said, Rich, using these things help you take part in life. And I have that changed everything for me, and I haven't had a problem with it since, but I've also passed that on to so many people struggling with that, and it's helped them over the last, say, 8 years, that it's just such a great way to think about it, that you can take part in life. You don't have to sit on that chair in the mall while your family is shopping and stuff. So that was a great thing. And Patricia, you had put on the screen that, MS is a disease that mostly deals with, it's an inflammatory disease. And they used to be afraid to say that about MS, that it was inflammation that was an issue years ago. And now it seems like they're saying it. But I'm wondering if there's so much to do with MS with inflammation, why aren't more practices like you all's, everybody's, that handles MS using nutritionists in their practice? And I'm sure it's a money thing, and I'm sure it's a reimbursement thing, but why aren't they using a nutrition? Because we all know that meat and animal flesh is very inflammatory for your system to eat, very bad to eat, and then everybody is eating meat. So I don't know why that would be if we're all fighting inflammation with this disease.
So I agree that a diet is the most important thing that we have as far as maintaining overall health. And why that's not in our clinics versus being in your primary care doctor's clinic, because your diet affects not only your MS, it affects everything. And so, yes, we do make referrals to nutritionists for persons who are challenged with certain issues. And I make my last referral to a nutritionist was actually for a person who was a vegan. So it wasn't necessarily a person who wasn't eating well. The problem is that we are on the tip of the iceberg as to what contribution that food and our gut make to this whole immune system, and we don't again have a recipe that if you eat this and this, that it's going to be really wonderful for you, or if you don't, or if you do eat this and this and this, it's going to be really bad. We have guidelines. We know that salt is really bad. We know that low vitamin D levels are really bad. We know that foods that are fat. So we know some things, but persons in other disease states could argue that, those things are good for diabetics. Those things are good for persons who have heart disease. So your comments are very well taken, and I think that we are moving along in that direction, and I would challenge everyone to look at how can you be healthier in your diet.
Do you want to answer, Patty?
No, I had just a general comment too, along those same lines. I think that advice that I give someone who is newly diagnosed or diagnosed for 30 years is always the same. I say you try to control the things you can control. You can control whether or not you take the medication that's best for you or prescribed for you. You can control whether or not you eat a healthy diet. You can control whether or not you exercise, and you can control to a good extent what your attitude is, as Trish kind of ended. You can make a choice that this is not the end of the world and that you're going to choose to have the best life that you have. So those four things, and diet is one of them, kind of is an overall package and what I recommend for, like I say, someone newly diagnosed or diagnosed 30 years.
Thank you. Good question.
Yes, last year I heard quite a bit of stuff about stem cell research for MS, and are they still testing or whatever? Or if they're not, why aren't they?
So we are still doing stem cells. There are controlled trials with stem cells, and I do know that there are persons that go to places and get, quote, stem cells that I think there's been some persons that report benefit, but they're not controlled, and we really don't know what persons are getting. So we're still looking at stem cells, and we are at this moment still reserving that for persons who are a little more disabled than early on in the disease. And it's trying to find that right balance. And so I would challenge persons, if you really want to consider stem cells, there are trials that are currently enrolling. You can go to either the consortium's website, you can go to clinicaltrials.gov, and Stuart has some of them on his website, and so does the National MS Society.
Hi. Yes, don't have a question. I just want to let everybody know, next Wednesday, Tricia has a meeting in her office. It's the MSGO meeting. It's going to be our kind of end of the year, and Tricia's going to do crafting and things like that to get your hands moving. So, you know, a lot of us get stiff in the hands, so we need to know by Saturday morning if you plan on going, so we have enough supplies for everybody. So if you can get hold of me or give me your email, or rather, I'm sending out the information, but it's next Wednesday at 301 North Maitland Avenue. And it starts at 6:30, and it's usually till about 7:30. And we're going to have a few things like a cake and everything for the holidays.
That's fattening.
You can work it out in January.
Hi, Patty. It's Naida. Hey, maybe both of you the question. You mentioned that one of the challenge for me, when you go to a gym, not every trainer, I will say none of them, are kind of prepared to work with us. It's very different. So is anything in a plan, or maybe think about it a way that we can send these people to, if somebody's interested to get trained? Because I talked to a gym I was going, and some of them show interest in, you know, learning how to work with us, but I don't know where to send them.
Yeah. So it is a challenge, and it's not only a challenge at the level of personal trainers, but it's, you know, as you know, that it's a challenge for even professionals to have somebody who, you know, knows all the ins and outs of MS or has a practice dedicated to MS. So we're trying on a lot of different avenues to try to educate more and more people on that. I mean, we have efforts going on at the consortium to interest students earlier on in their career. My student here is here tonight, Sam is there, to get a career interested in a career of MS. From a professional level, what I do is that if you go to a gym and you've identified a personal trainer that is interested in working with you and you working with them, I always advise you to have them, with permission, let me discuss your case with them so I can educate them not only on the particulars that you have, but also on the particulars of MS. And that way there is maybe not a level of expertise, but a level of knowledge, and maybe we spark a little bit of interest so that they become more interested. And that's how we've developed a lot of our programs, is through just a little spark or a seed, and someone's got an interest in that spread. The MS Society, it's been years back, but we did training for aquatic instructors. So we've had those resources available to us too, but we understand from a professional aspect that there's not enough of us to go around to adequately support all of your endeavors and all of your exercise and community goals. So, you know, what we're doing is sometimes on a case-by-case basis, but there's also a movement with the consortium too, is, you know, we have a certification for professionals to be a MS certified specialist, and there's some discussion now opening that to other people who might have an interest, like personal trainers or people who are out in the community, to have a certification in that at a different level, but there's been talk about that. So I understand the challenge.
How do you get referred to a physical therapist? And if you need wheelchairs or other kind of tools to help you in managing with your walking or whatever, who do you get that through? Who do you go to?
So to start out, what you do is you talk to any of your physicians, hopefully your neurologist or your nurse practitioner who's managing your MS, for a referral to a physical therapist, occupational therapist, or a speech therapist. There are a lot of we're really lucky in Orlando. We have a lot of good resources on all levels for people with MS. But if you come to, say, for instance, my center, you come in, you get an evaluation, and we set up a treatment plan for you. In regards to your question about equipment, we have, myself in particular, have a special certification in assistive technology, meaning that I know the ins and outs of wheelchairs and assistive devices, so I can help trial different pieces of equipment to see which one would be right for you. How many of you have ever thought, oh, I've seen that on the internet, I'm going to order it, and you come and you get it and it's not right, and you end up having a closet full of equipment that none of it works for you? You could actually have a supply company out of your own closet. So we're trying to avoid that for you, to make the good choices right up front, and then also knowing the ins and outs of dealing with the insurance companies and making sure that these items that you need are covered and what your benefit is. So just need a referral. You're welcome.
Are there any other questions? I don't see any. So we want to thank Patty and Patricia for being here today. Thank you very much.